DC forensic nurse examiners help victims of sexual assault throughout the district. Erin Pollitt is the executive director.
Some of the message that violence is an emergency has been kind of lost in translation.
An unintended consequence of the chaos of a global pandemic.
Patients are being told to stay away from the emergency department unless they are dying.
So some sexual assault victims may not go to a hospital, which could mean they don't get critical care or have evidence collected if they want to pursue criminal charges for what's happened to them. According to the nonprofit's data, in March of last year, there were 52 calls for them to help someone. March this year, just 35. That's a 33% drop. In fact, Pollitt says at the end of last month, there were multiple days in a row when they had no calls. She explains that's very uncommon. We need to give you some context here. On one hand, part of that drop could be because people aren't out and about as much right now. There aren't any college parties or club visits. But Pollitt says during a time of social distancing, they'd actually expect to see a lot of patients coming to them.
A lot are in isolation. And so we know that that's a point of time that can be very dangerous for someone who has experienced abuse before or who may be isolated with their abuser.
They are making adjustments to try to encourage victims to get help. The group has added an extra nurse on call so survivors should not have to wait in the hospital. And they won't be seen in the middle of the ER. This private exam room shields them from all that activity.
If a sexual assault victim is watching this story, what's the one thing you want them to take from it?
We want you to be safe, and we understand that violence is an emergency, and we want you to feel like you can seek the care that you need.
To get that care, here's the number you need to know. It's the DC Victim Hotline, 844-4HELP-DC. Laura Geller, WUSA 9.